Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is what you need to know about epidural injections. An epidural is an outpatient procedure involving steroid and numbing medicine being placed into the epidural space. Epi means around, dura means the dural sac, which is the covering of the spinal cord. So it doesn't go into the spinal cord, it goes around it. It's designed to relieve the pain from nerves that are pinched. The injection, as mentioned, does not go into the spinal cord. It also doesn't go into the nerve roots. Okay, it doesn't go in here, it doesn't go in there. It just goes around the spinal cord. So the indication for an epidural steroid injection is predominantly a herniated disc with radiculopathy or sciatica. So basically you have a disc, actually this is a disc bulge, but it's pushing back on the nerve root it's trying to get off the spinal cord, and it's inflaming this whole area and causing pain in the area that this does sensation for. Also, spinal stenosis is an indication for epidural injections. Nerve roots that are inflamed due to degenerative disc disease, a tear in the outer part of the disc, which is called an annular tear, and then compression fractures can also irritate surrounding nerve roots. There are three different types of epidural injections. The first type is an interlaminar. This is a lamina, this is a lamina, and this is the interlaminar space. Okay, a pain doctor puts the needle through, it goes through the outer layer of soft tissue, and then it enters the epidural space. Okay, so this is the one that was started back in the 1950s, so it's been over 50 years that pain doctors have been doing these types of injections. The second type is called a transforaminal. The needle doesn't go back here, it actually goes in the area where the nerve root comes out from the spine. This is an area called the foramen, this hole here. So a transforaminal is when the nerve, the pain doctor puts the steroid medication around the nerve here. And that's closer to where the nerve root is typically getting pinched. Okay, caudal epidural injection is where the needle actually goes at the very bottom. So here's the lumbar spine, the sacrum. This opening is called the sacral hiatus. The pain doctor will inject here a larger amount of numbing and steroid medicine, and it will migrate up, and it can work on multiple areas to provide relief. This is great for spinal stenosis, where typically multiple nerve roots are being pinched. The injections are performed as an outpatient. They take about 30 minutes. The doctor will administer local numbing under the skin, and also IV sedation may be used if desired. Modern pain doctors do use the C-arm here. It's called fluoroscopy, and that shows in real-time x-ray that the needle is being placed accurately. Ultrasound guidance is also sometimes used. This is great because back before image guidance, up to 40% of epidural injections were misplaced. So now they're much more accurate. Okay, typically a pain doctor will inject dye to make sure the needle is accurately positioned. Patients go home the same day, typically within about an hour. How well do they work? Dozens of studies have been performed looking at epidural injections. Overall, it's around 75 to 90% good to excellent results. You may need a series of 3 injections over a 6-week period to get maximum benefit. The numbing medicine that's placed will start to work immediately. The steroid medication may take 1 to 3 days to kick in and start to work for anywhere from a few days to a few months. Okay. Now, what are the risks? The risk profile is very low for epidurals. It's less than 1%, but it can include infection, bleeding, so you should stop anti-inflammatories 5-7 days before the procedure. Could be an allergic reaction, side effects of the steroid, which are usually transient, like increased blood sugar, transient hypotension. Could be a nerve injury. It might not work, and the complication rate is under 1%. Are epidural injections FDA approved? The answer is no. They're not FDA approved or denied. This is not a bad thing. This means they're used off-label for use in the spinal canal. 40% of medications are used all the time for off-label indications. It's legal. It's often beneficial. All it means is that no company has spent the tens of millions of dollars it would take to get it on label. Examples of off-label medications include Neurontin, Lidoderm skin patches, propranolol for performance anxiety. So people try and say it's a bad thing. It's not. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified, award-winning doctors. Visit us online at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.